All right, let's talk about something where every single second counts: meningitis. This isn't just another infection. We're talking about a full-blown medical emergency, one where knowing what to look for can literally be the difference between life and death. So let's dive right into what makes this condition so incredibly dangerous.
You know, this description really just hits the nail on the head. It perfectly captures the terrifying reality of meningitis. It strikes with shocking speed. A person can be perfectly healthy 1 minute and then critically ill just a few hours later. We're not talking about a slow buildup here, no way. This is a sudden, violent storm just erupting inside the body.
So, here's how we're going to break it all down. First, we'll cover what it is, then we'll get into the telltale signs you need to know. After that, we'll look at the one decisive test, how doctors decode the results, who the main culprits are, and finally, why it's such a desperate race against time.
So what is actually happening inside the body during this thunderclap? To really get it, we need to start with the basics. Okay, so picture this. Your brain and your spinal cord are wrapped in these 3 protective layers called the meninges. Think of them like a security blanket for your entire central nervous system. Meningitis is what happens when those layers get infected and dangerously inflamed, and that puts a ton of pressure on the control center of your entire body. And this is what makes it so critical. The outcome really hangs on a knife's edge, balancing on just 3 things: the patient's own health, the specific germ that's causing all the trouble, and, most importantly, how fast treatment gets started. This is not a wait-and-see kind of illness. Not at all.
So how on earth do you spot this invasion? Well, the body starts sending out some very specific, and I mean dramatic, warning signs.
Doctors are always on the lookout for this classic combo called the meningitic triad, and the key here is how specific these symptoms are. We're not talking about a regular headache. Patients describe it as this intense helmet-like pressure. The vomiting isn't gentle, it's sudden, it's forceful with no warning. Even the constipation is a clue because it's just so unusual. Seeing these 3 together, that's a massive, massive red flag.
And then there's this. All that inflammation in the meninges causes extreme stiffness. You might see someone lying in this very distinct position with their head thrown way back and their knees pulled up. It's not because they're trying to get comfy, it's actually an involuntary reflex to that intense pain and pressure. But of course, babies can't tell you they have a headache, right? So their signs are completely different, and you have to be extra vigilant. Parents need to watch for a really unusual high-pitched cry, a bulging soft spot on their head, a sudden refusal to eat, or even seizures. Recognizing these signs is just absolutely vital.
Okay, so the alarm bells are ringing, but doctors need proof, and there's really only one way to get it.
This is the moment of truth. A lumbar puncture, also known as a spinal tap. It involves taking a tiny sample of the cerebral spinal fluid. That's the fluid that surrounds the brain and spinal cord. It is the only way to get a direct look at the scene of the crime and figure out what's really going on in there. You know, that little sample of fluid holds all the clues. And the very first thing doctors check is just what it looks like, because that one detail immediately splits the investigation down 2 very different paths.
So if the fluid comes out cloudy and thick, doctors call it purulent, that's an immediate, flashing sign of a dangerous bacterial infection. But if the fluid is clear, the suspicion shifts towards a virus, though other serious culprits aren't off the table yet. This one visual test basically sets the course for everything that happens next.
Now let's play detective and look deeper into the fluid. With a bacterial infection, it's like a war zone. The body sends in a huge army of white blood cells to fight. You'll also see high protein levels from all that inflammation. And here's the dead giveaway. The sugar, or glucose, is really low. Why? Because the bacteria are literally eating it for fuel to multiply. But with a viral infection, the changes are way less dramatic. Sure, some elevated white blood cells, but the sugar's normal. The fluid itself tells you exactly what you're up against.
All right, so the fluid is screaming bacteria. Now the next urgent question is, which one? And it turns out there are a few notorious culprits that doctors are most worried about.
First up, the big one, meningitis. This is the one you hear about causing scary outbreaks in places like college dorms. It actually spreads through the air, which makes it super contagious. Its calling card is this terrifying purple rash called purpura, which is a sign that the infection is just overwhelming the entire bloodstream.
Next on the most wanted list is pneumococcus. This bacterium is known for being extremely severe, and it's a major cause of death from meningitis. It doesn't really cause epidemics, but instead, it strikes the most vulnerable among us, the very young, the elderly, or people with weakened immune systems. It often just piggybacks on another illness, like an ear infection or pneumonia.
And our third culprit is a bit of a sneaky one, listeria. This one is different because you get it from contaminated food, things like unpasteurized cheese or deli meats. For most healthy people, it's just a mild flu-like illness, but for specific groups, it's devastating. We're talking newborns, the elderly, and pregnant women, where it can be incredibly dangerous for the fetus too.
But you know, the investigation doesn't stop there. Especially if the fluid is clear, doctors have to rule out other really serious causes. Things like tuberculosis, fungal infections, or even a severe herpes virus infection in the brain. The list is long and the stakes couldn't be higher.
So with the clock ticking like crazy and a dangerous culprit on the loose, how do we fight back? This is the final and frankly the most critical piece of the whole puzzle.
There is one golden rule in treatment, and it is non-negotiable. You do not wait. The second bacterial meningitis is even suspected, that patient is started on powerful, high-dose IV antibiotics. Doctors can't afford to waste time waiting for lab results. They have to act on suspicion, because every single hour that's lost increases the risk of permanent brain damage, or worse.
But you know what's even better than treatment? Preventing it from ever happening in the first place. And this is where modern medicine really shines. We have amazing vaccines that protect against the most common bacterial culprits, like meningococcus and pneumococcus. They are our absolute best line of defense. And for people who've been in close contact with a patient, doctors can prescribe preventative antibiotics to stop an infection before it can even start.
You know, from that thunderclap headache in an adult to the high-pitched cry of a baby, knowing the signs is where survival truly begins. It's what gives you the power to act fast and to start that critical race against time. So after all this, what's the one sign that's going to stick with you?